Good morning, everyone. My name is Zach Feldman. I am an occupational health physician assistant with Vail-Summit Orthopaedics. Thank you for joining us this morning for my introduction to Vail-Summit's occupational health program. A little bit about me. I was born and raised in Boulder. I went to Bates College in Lewiston, Maine, graduated there in 1997. With a bachelor's of science in German and biology. Couldn't get much further from Boulder. That wasn't planned, but it happened. Following my graduation from Bates, I worked on small expedition cruise ships sailing between the Arctic and the Antarctic and many, many places in between. I worked as a cruise director, hotel manager, purser, kayak guide, bartender on those boats. 2003, I began my path to becoming a physician assistant by becoming an EMT in the Denver metro area. I worked in Aurora and the city of Denver. In 2006, I started my path to becoming a PA by being accepted to Duke University's physician assistant program. Graduated there in 2008. I got a Master of Health Science in Physician Assistant Studies. For the last 5 years, I've been doing occupational health. I am level 1 accredited with the state of Colorado. Prior to occupational medicine, I did a fair bit of orthopedics. I worked as a hospitalist physician assistant at a Vista hospital outside of Boulder. I dabbled in urgent care and did a little bit of ear, nose, and throat. Ear, nose, and throat was way too slimy for me. Much prefer occupational health and orthopedics. So a little bit about our program. Vail-Summit Orthopaedics and Neurosurgery began its occupational health program in the beginning of August. We are a primary occupational health provider. Essentially, what this means for you all is that should you have injured workers, you can send them straight away to us here at VSO, and it doesn't need to be an orthopedic injury. I will see all injury types, and if it's something that I don't feel comfortable with or that I feel needs to be referred out to a specialist, I've established a good referral network that includes dentists, health, mental health professionals, eye professionals, and many others. So not to mention here in-house at Vail-Summit Orthopaedics, I work closely with the orthopedic surgeons. I also work closely with physical therapists, with Avalanche Physical Therapy here. We also have imaging in-house. We have X-ray and MRI. One of the great things about working here at VSO is to take care of your injured worker. In most instances, we don't need to send them all over the county to receive good care. Now, that being said, if you, the employer, or your employee has a relationship with an orthopedic surgeon or with a physical therapist, and that route of care is necessary, so long as your workers' comp insurance covers those providers, I will happily refer to those providers. But again, we've got so much under one roof, and it's quite convenient for everybody. Other important things for you all to know is that here at VSO, my regular hours are Monday through Friday, 9 to 5. And then we have weekend hours of noon until 7 p.m. We also have expanded hours during the weekdays until 7 p.m. So injured workers can be seen weekdays 9 to 7, weekends noon to 7. Something that is extraordinarily important to me, and I think it helps keep stress down for employers, employees, and everyone involved in the workman's comp arena, is open communication. I find open communication and everyone being straight up with each other is extremely important. And my goal is to keep that communication alive. When it comes to my communicating with you, the employer, I will see your patients, and your patients can come in on a walk-in basis, or if you have questions, go ahead and give us a call prior to your patient coming in. But the open line of communication, once I see your patient, within 24 hours and most times within hours, I will get back to you, tell you how the visit went, what work restrictions I've put into place, and what the plan of care is. Now, getting into plan of care and injuries. If at all it ever crosses your mind that your worker's injury would need an ambulance or an emergency department, go down that line of thought. Or if you're not totally sure, give me a call. I'll have my contact information on the last slide. But if you ever think the ER or a higher level of care is in order, follow that route. The other part that's important as a philosophy of mine is I rarely, if ever, will take an injured worker completely off of work. There's been a few instances that I do so, but rarely do I do this. I find it very important for everybody's case that you get straight back to work. So that's my philosophy, and I'll work closely with you as the employer, and I look forward to working with you as the employer. Some things coming down the pike is beginning in January, we are planning on doing Department of Transportation physicals. I am a Federal Motor Carrier Safety Administration medical examiner. And so in January, we'll be starting with DOT physicals, if that's something that's important to you all. Also be doing employment or pre-employment physicals starting in January. And currently I am going through the process of getting DOT drug testing certified, and starting in January, we'll be available for that as well. So, and then it's a little bit of trouble with my PowerPoint. So in summary, we are new to Summit County in providing primary occupational health, and we are providing a choice here in the county, so keep us in mind. As I said, through communication and explanation, I want to take the stress out of workers' comp. Please do not hesitate to contact me with any questions. I am pretty good at answering them, and if I have issues answering questions, I will find the answer for you. Again, I want to emphasize the importance that we have a convenience of a single location with many services. We've got our orthopedic surgeons here, we have physical therapy here, as well as imaging here, X-ray and MRI. I want to again emphasize the importance of the open communication. And finally, if in my brochure you don't see things that are important to you, please call me. Let's discuss it and see what I can do for you. This is my contact information. Please feel free to contact me at any time. Also, I'm giving you my contact information. Under the chat, I would greatly appreciate it if you would share your contact information with me. I'd like to thank you all for your time this morning and coming to this webinar. I'd also like to thank Rachel Follender for helping get this organized and all the behind the scenes. Now I'd like to open it up for any questions that you folks may have.
So it looks like we do have a question already, Zach, from Amy, and she wants to know, what will we charge for pre-employment screens and physicals?
That's a great question, and I need to work with our physical therapists and Avalanche to determine that, but I will definitely get back to you with that answer. I'm getting that answer right now. We'll charge probably somewhere around $70 for those screenings and physicals. Impairment rating is a question. As a physician assistant, I am unable and not allowed by the state to do impairment ratings. I would need to refer those out for if a patient requires an impairment rating.
Does anybody else have any other questions? If you have any questions you think of later, you can feel free to reply to the email that was sent from this webinar. We can answer them there, or you can email Zach at ocmedinfo@vsortho.com.
We've got a couple more that just came in. The 164s, I absolutely, and I didn't address that well. When it comes to 164s and any other pertinent documentation, I want to work with you as the best way to get that information to you. But generally, I will give the patient 2 copies, one for themselves, one to get back to you as the employer, but I will also email those 164s to you. And I will always check with you to make sure I have a good email address. And many of you I've spoken with already and collected email addresses. Cost of MRI is another question. And that has, that again, I will need to get back to you on, but again, that is generally covered through workman's comp insurance. So that will go through workers' compensation, your coverage. Any other questions?
Maybe give it one more minute in case any last minute questions roll in.
Sounds good.
So it looks like we had one more person jump in. Not sure if they're still on, but if you have any questions for us, since you jumped in late, feel free to shoot them over chat and we'll try and answer them as best as possible. All right.
And also, needless to say, give me a call following this webinar, and I'd be more than happy to take your questions or talk to you on the phone following the webinar.
Okay.
Thank you, everybody, and don't hesitate to contact me.
Thanks, everyone. Have a great day.